welcome to Open Forum, and I'm Tonia Mastrobuoni. I'm a correspondent for an Italian newspaper called La Repubblica. I live in Germany, and but I'm Italian. And the title of the panel today is very ambitious. It is about ethical decision-making in times of crisis. We're speaking, of course, about pandemics, but we have such an extraordinary panel that I'm sure that we will have a super discussion. I told you that I live in Germany, and when the pandemic broke out in 2020, in March, the whole world saw this horrible photographs coming out of Bergamo, of an Italian city where military were bringing out coffins of dead COVID people out of the city. There were too many. And in this period of 2 years, we have seen so many decision-making processes, some very right, some very wrong, I think. And so maybe we can talk about this with this very important panel that we have converging tonight here. I think one of the questions that, of course, came up immediately was that of how can we cope with this horrible virus of coronavirus, and the lockdowns were one solution, but very different lockdowns. I mean, I remember, for example, in Germany, you could get out of your house. I did very big bike trips every day, but I saw my friends and my family in Italy. They were totally locked into their houses. So where is the limit? How far can the government go? We know in China there's a very radical, for example, solution to this. The zero COVID policy, it's very binding, very severe. And I think, and then a second topic, of course, came up in these years, and it was the terrible moment of the triage when doctors had to decide whom they would save. And the third topic I would like to touch tonight, and maybe fourth and five will come up within the discussion, but the third, of course, is the polarization of society. Because one thing that really astonished me as a journalist at the beginning, since the beginning of the COVID, was how so many people could distrust science. The mistrust in science was one of the biggest topics that came up, and that made decision-making also very difficult for governments and politicians. So I would start from the very top, from ethics, from the decision-making process and how it should be. And maybe we could start with Anna, Riedel. She's Austrian. She's a global shaper of the Economic Forum and of the Vienna Hub, and maybe she can also present herself and add some details that we don't know about her. And I would ask her, well, what should we take in account when we're deciding something very, very, important, like saving one life or another, or imposing a lockdown, a light one, a heavy one? What is the process in this decision-making?
Thank you very much. Yes, first about me, so you have some background information. So I'm here as a global shaper to represent the global shapers community, in particular, in my case, the Vienna Hub. But I also have two other roles. One is I'm a cognitive scientist, and I study rationality, which means optimal decision-making under radical uncertainty, and in general, how intelligence works in organisms, but also in machines. And I'm also involved with a movement that's called effective altruism, where people try to make, good decisions about impact and think very strategically about, how do you actually, what is the best you can do? How can you actually do the most good? And we really look at data and try to weigh all the trade-offs. But then to your question, so let's start in the very beginning. We talk about decision-making in a crisis. So what is a crisis? Every one of us, we learn about the environment around us, and then we behave in accordance to that. And a crisis means that the order to which we have adapted completely changes. There are new rules. So this means there has to be some radical change. So of course, the first step you have to make in such a situation is actually taking a step back and looking at how you've adapted to the environment before, acknowledging that it is very different now and that you will have to behave differently. Otherwise, it is exactly a turning point where things can go well or can go really badly. Then when you look through a lens of health economics, in a situation where something very quickly emerges like COVID, you have various trade-offs. You can think longer, you can gather more information, but you also know in every moment there is a loss of life. So you have to always trade off gathering more valuable information with acting quickly. So often having then good rules of thumb is actually better than just thinking more concisely about everything. But this brings me to the even more important point here, which is if you start acting and making decisions in a crisis, then I think you have already failed, because what you actually need is, first of all, good preparedness, because we know about many things that are not unlikely to happen. And we did have the information before that there could be a pandemic, and we do know about many other risks that we have and that we can already prepare for. But at the same time, of course, we don't know everything, and we never will. So you cannot, of course, just do what is most probable and prepare for that. But you also need a system that just has slack, that can just change and react dynamically to completely new things.
Thank you to Anna Riedel. And you were talking about you should be prepared. Well, we weren't prepared at all for this pandemic, and there was a lot of discussion about this too at the beginning, because we should have been prepared. And so Klaus Moosmeier is Chief Ethics at Novartis. His job is to build trust. Well, at the beginning of the pandemic, I thought two things. One was this, that of course we were not prepared. It was very, very commonly discussed. And the second problem was that what came up was a big distrust in pharmaceutical industry and also in science. Where does this come from, and how can you repair this?
Yeah, thank you. Big topic, because trust, we discussed this before, is a loaded word. What does trust really mean? But for a society, and the company is part of society, I mean, trust is as of importance as for a school or as for a university or for a whole country. And I mean, to be fair, and I think ethics, we can discuss now hours what is philosophical background of ethics, but it's basically doing what's right from my point of view with kindness. I think kindness is often underestimated if you explain topics which are so close to all of us as health and life. I mean, this pandemic situation was a threat and is a threat to our lives. And as an industry, and you can criticize the pharmaceutical industry for many good reasons, but one thing is, it's the industry which is maybe most closest to human life you can imagine. Therefore, there was, of course, a certain preparedness for such a situation, not in the sense of a pandemic, but what are mechanisms which can work in such a situation? Kindness, and then explain. Explain not only from a pure scientific point of view, which is important, and I mean that is the basis of fighting against a disease, but the human point, what does this mean? What does this mean for responsibility for citizens? Because to take a vaccine is a known, very personal decision. It's also an ethical decision for society, right? Because it's a societal problem to fight against the pandemic. And what we try to do in the company, which is a huge company, employing more than 100,000 people across the globe, but also with all the stakeholders, the patients, the doctors, the governments, was to how can we better explain prevention? And you know, prevention is a hard stuff. Think very basically at the firefighters. I mean, people always are hesitant to invest in prevention, right? And then when the crisis is there, we are not prepared. And then I think for defending a little bit maybe the political decision makers who tried to build trust, they were not prepared. They had to make very fast decisions. And then it's very easy to criticize, of course. It's always they should do it differently. And I always say, look, I mean, just imagine you would be the Minister of Health for your country. How would you feel? Because you have to make decisions which are very difficult and you don't know what impact these decisions will have. Because the uncertainty is a big issue if you talk about trust. I think there are two big issues with trust. One is if you're cynical, if you have cynicism, this is very dangerous for trust. But the uncertainty, what you always have, because the pandemic was unknown in our generation, the last one was the Spanish flu, which was many decades away for Central Europe, now I'm not talking about other countries. So transparency, a human touch, if you explain why we should get vaccinated, why this is important, and using science maybe, and that was maybe the mistake in the crisis, explain science in a more human way to understand what is science, what is the basic of science, why everyone should at least discuss this and be a part of a discussion. And before I close, I think it's now a buzzword, sorry, crowdsourcing is super important. We launched in the middle of the pandemic our new code of ethics, and we crowdsourced it by basically all of our associates in the company. We involved nearly everyone in every country to write the code of ethics, give ideas, what is important for you. Because we believe if you crowdsource ideas, also how to fight the pandemic, how to get the citizens involved, then you feel a personal responsibility suddenly. It's a part of you. It's not a law, it's a topic, it becomes personal. So to build trust, I think, to make it transparent, be kind, make it human, and crowdsource, involve society to the extent possible.
Thank you, Mr. Moosmeijer. Michaela Jade came all the way along from Australia. She is, I think, still in the jet lag, and she is a woman, a Cabrogal woman of the Darug-speaking nation of Sydney. And so this is a very important testimony of course, of a community in Australia that gives us an insight into how these indigenous communities lived through the pandemic, and also for example, we were speaking before about the question of trust in the vaccines. Can you tell us, Jade has also found that she's one of the most important digital, she founded in digital in 2014, if I'm not wrong. So the first indigenous high-tech startup, and I think it is very important also to have an insight on what happened in these communities. So Jade, can you tell us how also, were you involved, for example, in the decision-making process in Australia about vaccines, about, I don't know, lockdowns and so on?
Wanami, I must introduce myself culturally. I am a Cabrogal woman from the Darug-speaking nations, and I would like to pay my respects to my elders, past and present, who have been custodians of our knowledge, language and law since time began, and held great responsibility for our people to help us get through things like pandemics. And I will also put the caveat out there, I am not a healthcare expert. I am an environmental biologist, and I also have a master's in applied cybernetics. So health isn't really my area of expertise, but I am a human being and a Darug woman that went through a pandemic with everybody else on planet Earth. I would like to say that our people were only saved by the actions of our Aboriginal and Torres Strait Islander health professionals who did an exceptional job of working within the context of our Aboriginal and Torres Strait Islander communities in the pandemic. And without them, I think the loss of our elders would have been catastrophic. Our elders are like our universities. So there was a great threat to our people in losing more of our knowledge, language and law if our elders were affected by the pandemic. So our communities really rallied around our most vulnerable people, and I think that's a really important part of our experience. But in saying that, my community are from the western suburbs of Sydney, And we had elders sleeping in tents in their backyard on their own for 2 weeks at a time, so they wouldn't pass this disease on to the other members of their family, not knowing at times if they were going to die during the night and being absolutely terrified of their families having to find their bodies in the morning. And we couldn't go and be with our elders in those cases to go and support them because of the lockdowns and the tight restrictions that we had. So that was really scary for us. I think as a technologist, what I also observed was our government rushing towards a technological solution to try and stop the spread of the pandemic. So things like apps were heavily invested in at the early stages, where if our people had a seat at the table at the start, we probably would have not gone for technology first to manage our communities through a pandemic. We would have probably taken, firstly, a country-centred approach, so thinking about the environmental conditions and the connections that our people need to country for our well-being, and then to a human-centred perspective on how to make decisions around what's best for community dealing with the pandemic. So we are people that have significant intergenerational trauma from things like pandemics. Pandemics are not new for our people, and were in fact used as weapons against my own Darug people when we were colonised through diseases like smallpox. So our community had a very high level of anxiety in dealing with the pandemic because we haven't forgotten the impact of the last pandemics that were used as biological weapons against us when we were colonised. So we've kept that trauma in our communities, and to be confronted with another pandemic and have that led by government authorities was also very challenging for our people too.
Thank you very much. You mentioned smallpox, and we have here at the podium one of the greatest experts, I think, in the world. He has been living for 10 years in India, am I right? Larry Brilliant, he's founder and chief executive officer of Penn Defense Advisory. He has been vice president of Google. He is epidemiologist, and so he has a lot of experience, of course, in the field. But I wanted to ask him also about these ethic problems that we're posing, trying to solve tonight, which is very ambitious. But well, first, give us an insight, some information also about this moneypox that is coming up. Is it dangerous? Should we be worried of a new pandemic now, because the cases are multiplying a lot? And the second question is about vaccines. We talked about it before. You suggested. I think it's a great question. How should we decide when someone is already ill, or someone is already incubing the virus, should be vaccinated or not? And in general, how should we approach in societies this question, which polarized society so much in the last 2 years?
Well, first of all, thank you so much for inviting me, and thank you all for coming. It's very rainy, and we weren't sure any of you were going to come. And I can't go anyplace else without acknowledging my sister and saying to you, of all the wonderful things that makes me proud that we have eradicated smallpox and eliminated it from the world, it is so that it would never be used as a biological weapon, and it was used as a biological weapon against Native Americans in my country, so much so that a British general, whose name was Lord Geoffrey Amherst, wrote a letter of instruction to his colonels in the war against the Indians, the French, Americans, and the British, and he said, the best way that we can control our enemy is to give them blankets filled with the crusts of living smallpox virus to exterminate them. So it is both a heavy heart when I hear you say that. It's also a great heart that I feel like we have eradicated smallpox. And so my background is I am an epidemiologist, and I did help to run the smallpox eradication program for the World Health Organization in Asia and in India and South Asia. And I worked in the polio eradication program as well. And when we talk about ethics, perhaps later on, we'll understand that the ethics of a disease that can be eradicated is very different than the ethics of a disease that can be controlled. And it's also very different if you're dealing with someone who you ask to be vaccinated when there is very little risk to that person, as opposed to when there's a great deal of risk. And in monkeypox, we'll come back to that subject in just a second. So I'm a physician and I'm an epidemiologist, but my real training, I think, took place when I lived in a monastery in the Himalayas for 3 years. And we studied all the different religious teachings on ethics. And for me, that came after, how many of you are students? Yeah, undergraduates? Graduates? Graduate students? Little, okay. Well, when I was an undergraduate, I started off at the University of Michigan in atomic physics. That was so long ago, we didn't have the term nuclear physics. But it didn't seem very ethical to me to be in that field after witnessing the mushroom clouds over Hiroshima and Nagasaki. So I made a pretty large shift that many of you probably have done as well. I went into ethics, and I studied philosophy, and I got a degree in philosophy and ethics. And so I want to be an advertisement to you to study philosophy and to study moral teachings and the teachings of Kant, and especially as we talk about public health, the teachings of Jeremy Bentham and John Stuart Mill, who created utilitarianism, the study of ethics based upon the idea that you act in such a way as to further the greatest happiness, the greatest well-being of the greatest number of people. And they created an idea that there is a util, a unit of happiness. And so much as you maximize that for the whole community, you're on the right path. And I start off with that grounding in ethics and logic because we are forced to have decision-making under conditions of grave scientific uncertainty in every crisis. And watching scientists make a decision that is not based on prior research is a very messy thing. It's not pretty because we want to wait until we have some certainty, but there's not time to wait. So we are all in the same boat. We're going through life trying to do the best we can, muddling through, trying to make the kindest decision that we can make. One of the great moral teachings of Tibetan Buddhism. The Dalai Lama, when he was asked, what is the basic ethics of your teaching? What is the basic tenet of your Tibetan Buddhism? He said, warm-heartedness and kindness. He said, if you get that right, it doesn't matter what your religious teachings are. So I think that when I look at the problems that we have faced in COVID and the problems we will now face with monkeypox, there are so many questions that you have asked. I think we'll return back to many of them. I will pose one in regard to monkeypox, because I think that may open up a series of other ideas, if I could. So the vaccines that you're familiar with now because of the SARS-CoV-2 pandemic, these are all vaccines that are given to people before they are exposed to a disease. And they generate protection. The mRNA vaccines from Pfizer and Moderna, they particularly give you protection against getting sick, getting hospitalized, and not getting dead. They don't do a very good job of protecting you from not getting the disease, nor do they do a very good job of protecting you from not giving the disease. And each one of those factors will have to enter into your ethical deliberations. But because they're given to healthy people, there's a very high standard. You can't give a healthy person something that has more grave risk from the notion or the vaccine that you're giving them than the disease itself. It's different if someone is dying and they have a disease that we thought was incurable, and someone has a new medicine and research that maybe will save them. The risk-benefit profile changes, and the ethical decision-making changes. You're willing to take on a greater risk if the alternative are just death in front of you. So the vaccines that were given all over the world have done a sensational job of protecting us from having a higher death rate than we already have. And you may have read the WHO official numbers that say 5 million people have died, but actually over 15 million have died from the COVID pandemic. So it's a serious issue. It's a great pandemic, but it's actually a very mild disease compared to the diseases that I've worked with. Smallpox kills 1 out of 3 people who get it, and everybody gets it. The ethics change in that regard. And when we come to monkeypox, monkeypox is a cousin of smallpox. It's a family of viruses called the orthopox viruses. And there is a pox for almost every animal. Monkeypox is not really a pox of monkeys. It's a pox of rodents. And smallpox, perhaps 5,000 years ago, when Pharaoh Ramses V died of smallpox, and it was one of the biblical plagues, the plague of boils, it probably then also was a disease of rodents, and humans were the victim of zoonotic spillover. So we now go into monkeypox, a disease of mice and rats and giant Gambian pouch rodents that have affected some human beings, probably in Nigeria, and they came to Europe, probably to Antwerp, and they attended some parties that were based on kink and on an alternative lifestyle. Now, monkeypox is not a disease of that community. It's not a disease of kink. It's not a disease of the alternative lifestyle any more than it was a disease of monkeys. It is a disease of mice and rodents. And humans and people who have that disease now are accidental carriers of it, and that outbreak could have begun at a beach party. It could have begun at a convention of Christian evangelicals in the southern part of the United States. But it happened to begin in a community that had particular characteristics. Of the 200 cases of monkeypox, known and suspicious, less than 3 are women. And that gives you some insight to what that community is. And after that one party, meeting, conference, event in Antwerp, there were several others around the world. So this disease is now spreading like crazy, and I'm afraid that it may turn yet into fodder for people who want to blame the community in which it was found. And I hope we'll have a chance to talk about that, because it is not a disease of that community. It is not something caused by that community. So when we look at it now, if we had 100,000 doses of a vaccine against monkeypox and we deployed those in the right places today, this epidemic would be over. If we wait a month, we will need 10 million doses of that vaccine. And if we wait 3 months, we won't be able to put this genie back into the box. So now another element has to enter into your decision making. It's a burden, isn't it? Now we have to add the element of time. We have to act ethically, we have to act fast, we have to act based not on perfect information, and in my mind, we have to act and ask ourselves, what is the best thing we can do for the entire community? And so with that framework, that's how I make the decisions that I have to make every day. And I turn the question now back to you and how you want to put the other questions in order.
No, I was thinking about, I'm old enough to remember what happened when the HIV virus spread. And something very similar, it is very dangerous because it was spread by, of course, sexual contact. So the gay community was, especially in the United States, was discriminated. And when I read about how the monkeypox has spread, I had a sort of flashback and was horrified because I thought maybe this is going again. But maybe the society has learned something, and I don't see this sign of discrimination now. I don't know how you are perceiving it, but for example, Anna, if you see any signs of discrimination. I mean, we as a journalist, I think also learned from our mistakes, and in the 80s we made a lot of mistakes about AIDS and HIV. So maybe we can this time avoid this mistake. I don't know what you think. And the other question I was going back to, I was thinking about this one of the most horrible choices that doctors had to make during the pandemic was, of course, choosing between saving a COVID-ill person and having, I'm sorry, and saving a COVID-ill people and saving maybe terminal cancer, no, or someone who had cancer. So also there, I imagine that you got into this decision-making process. You reflected about it, and how can such a horrible decision be made? The famous triage, no?
Yes. This is exactly one of the principles or main ideas on which the effective altruism movement and philosophy is based on. So basically, whenever you think about ethics or about problems in the world, this is a situation we basically face all the time. When you just think about, so what is triage about? It's when you think about, imagine you have a small team of doctors and you have, for example, many wounded people around you. Now you have to ask yourself, okay, do I help the first person in front of me? No, this would not be the most ethical thing to do. And what happens, for example, in wartime or in general in emergencies is
like
exactly right now, during any emergency, is that we do triage, which means in wartime, for example, that actually there's a person that makes a decision and walks through the wounded people and gives them numbers on their forehead to decide, okay, here an intervention will exactly make the difference between life and death. This person is maybe in pain but will survive anyway, so we will just give them painkillers, but that's it. And then there's those people where it's pretty clear, no matter what you do, it's very unlikely that an intervention will do anything, so there will be no intervention done. So it's this prioritization. And this is exactly a metaphor for when you think just globally about problems that we face. We also have this basically economic problem of we have limited time, we have limited money, but there's an infinity of problems and causes that you could focus on. So it's exactly this question of what should I focus on? So the main three heuristics that the effective altruism community asks is then usually the size of the problem, how many people, or also if you broaden your moral circle, how many animals are affected, like how big is the problem and how bad is it? Then how tractable is the problem, like what interventions would really make a difference that we know about. So this is the main question of just expected value. So going back to what Mr. Brilliant said as well. And then, of course, you also have to ask yourself, how neglected is it? This is the question of marginal utility, in German, Grenznutzen. How much difference does another piece of intervention make? So if already 100 or 1,000 people are working on it, then you joining in might not make as much a difference as if there's a huge problem that nobody's working on, because then the first mover will make all the difference. So that's basically a principle that we apply in emergencies, but as an analogy, this is basically a decision-making we have to do every day. And Toby Ord, a philosopher from the Future of Humanity Institute and one of the founding fathers of effective altruism, he talks about the attention portfolio of humanity. So, for example, we know about a couple of risks that that are basically existential risks that could harm all of humanity that we don't work against properly, even though we know about them, because of course there's a couple of incentives to think way more short term. But then there's also big problems that are just, let's face it, just really not sexy. So they just don't get funded a lot, and they're still underfunded and therefore neglected, while being very, very cost effective to solve. Like, for example, schistosomiasis, which is a parasitic disease that I think 1 billion people still have. And I think the cost to solve it per year is around 50 cents, but it's something like that. So it's extremely cost effective, but it's still not done or funded enough, just because, there's things that are salient to us humans, what we like to think about, and then there are things that are just, not so salient, and this is not very salient. But to be ethical, you have to exactly look, where is the market for ethical decisions inefficient, and then you have to have the courage to jump in, which I'm only talking about, but we have one person that has done this very prominently in his life.
Yes. No, I was thinking about it. It is a bit off topic, but I imagine there is a lot of money put in. When I went to an engineer of Daimler, and he explained to me that one of the greatest ethical problems now of the car industry is, of course, when you have a car without a pilot, and this car is like heading, and he will like kill a child on the street. And the car has to decide if it saves the people in the car or if it saves the people on the street. This is also about ethical decision making, and there are very cynical sounding laws about this. And I think they come from the military, no? Like when you have a military plane, a plane full of people, and there is another plane that is threatening in this plane, which plane should be like put down, no? Is 200 passengers, have they the same value as one passenger? It's like the car problem without pilot, no? I don't know. And these are our problems, but I think this is an industry, so there's a lot of money put into this. I don't know if you have any thoughts about this, this triage problem.
Well, I come to triage in a second, and there's no solution there. I would say that's simply, we have to acknowledge that it's also ethical, a horrible situation for the people who have to make a decision. I just want to make one remark about the vulnerable minorities, and I include especially lesbian, gay, transgender, queer people in there. You said, well, you believe the society is far advanced, this will not happen. I have my doubts. I mean, we see, and as a global company, you see this. In some countries, it's still a criminal violation. And we all have our biases, and we should be very aware of our own biases. And it's very helpful to talk to people, to do what we do in a company, a reverse mentorship, for example. So I had a mentor who was a gay colleague who mentored me over a year, just to explain. This is a colleague from Europe, right? And there's no issues, it's all free. It's not. It's a lot of bias in there, and people have to hide, and so I would not have the courage to say that's all over here. It's not. So we have to watch this. We have to watch this out. The triage topics. I mean, these ethical questions are, I believe, they are at the end not solvable, because it's like with animal testing at the moment. You hurt an animal, you still need it for the advancing of medicines. It's basically, what is there ethical is to acknowledge a topic and to make it transparent and discuss it beforehand. And there's a lot of cynicism about these meetings like the WEF. I mean, I don't know what you think here. I mean, to Davos, 2,000 executives and people coming, what are they doing here? All blah, blah, what is going on here? But there's a value of open communication and discussion and exchange. It's not far moving, no decisions are made here, but to listen to others, to be open-minded, and to see what has worked, to benefit from such a huge experience then from the fellow panelists here, just to have these discussions. And we see a trend at the moment that in the world, unfortunately, we all say, yeah, globalization is something evil, but if you go back to nationalism and local markets, it's not better, I can tell you. And you will not fight a pandemic if you don't have a supply chain which works globally. No country alone can fight a pandemic. It's totally impossible. You need a globalization. Sorry to say this. And this make, for you as young students, I've been talking to my own kids who are under 20s, they're very critical. And father is an executive at Novartis. You can imagine how the discussions go in the evening. But it's healthy. It's healthy. It grounds me. It grounds sometimes them, I believe, because this is at least this openness what we need. And there are some issues we can't solve. And sometimes it's about the basic. And for me, one example is the war we have currently in Europe, the war in the Russians against the Ukraine. So I ask every day, why is Novartis still active in Russia? Why? Then I say, from my instinct, I would say, yeah, we have to move out. But then, what is the purpose at the end? This is the patients. And are there good and bad patients? And that's a little bit what we said. And we had a huge ethical discussion now in the executive committee to say, we stick to this. There's a patient, and he may be under a bad government or under good government. But should we add suffering that we cut them off from medical supply? Is this ethical to do this? And I have a clear view, but you may see this in a different way. But I think it's very healthy to have this platform to discuss these topics.
Michaela, Jade, how was your perception on this? I mean, and also because I insist, one of the most important decisions that were made in different countries, in different parts of the world, and I think your experience is very interesting there, is about how hard were the lockdowns, no? I mean, between Germany and Italy, there might be, in your perception, a small difference, or from Australia, because you say, well, it's lockdowns. But, for example, the simple fact to go out, to be able to go out of the house, which was prohibited in Italy and was permitted in Germany, this made in each individual was a huge difference. It was really a difference between feeling in the freedom to go out, to take a bike and to go somewhere, and not having this freedom and feeling really locked in. And then there are those very extreme cases like China, where, I mean, my colleague was like locked in for 1 month in a room because he was positive, and was given his food under the door, and he was really in prison. So is there too much lockdown, or?
That's such a tough question to answer. We experienced quite harsh lockdowns in Australia. I think we had an international reputation for being one of the most locked down countries on the planet, and I think Melbourne in particular almost took out the top lockdown number of days throughout the pandemic. And my team all work remotely, so we had colleagues in Melbourne who were really suffering from the lockdown, and my colleagues are Indigenous people. We employ mostly Indigenous staff in my company, and I think the yearning to be on country really created intense mental health problems, and something that I think First Nations people do really well is we don't just consider the situation and the risks in the moment. We also consider what the impacts of our decision making are for the next 7 generations. And I think that's a very difficult balancing act, and our elders carry that responsibility so well when they're making decisions on behalf of our entire community about what is the best response for now, but also considering what the best response is that's going to impact the future generations as well. And I'm looking at a sea of young faces here who will carry this story forward for the rest of your lives. You will share it with your children and perhaps their children's children as well. And in the decision making around the pandemic, we really need to look at what the impacts are for your generation and the generations that will follow you. You will have not only economic implications of this, but as a person that has lived experience of intergenerational trauma, you will have to work really hard not to pass that trauma down onto your children as well. So that's something that I don't think has been talked about enough in this pandemic, is the responsibility in decision making today for future generations. And for our people, that also brings in this conversation around climate change and around protecting our biodiversity. So as Indigenous people, we're quite famous for being custodians of planet Earth and being very dedicated to looking after our country and our sea country and even our sky country. And you may have heard of a statistic that 80% of the world's remaining biodiversity are under the management or control of First Nations people. We do have a deep responsibility for that, and we are questioning how we treat our environment. Is that actually contributing to increasing the risk of more pandemics in the future? Because as we deforest country, as we take away habitat for these animals that carry these zoonotic diseases, they come in closer contact, looking for food, looking for shelter, and for survival for their own species, and we're bringing them closer to us than what we might have been living with them for the past 200 years, for example. So we need to also consider our impact on country, on our lands, on our water, on our seas, because if we don't look after the planet, ultimately we're not looking after our own species.
Thank you so much. Mr. Brilliant, this question, being or not being vaccinated, no, which is also, as you said, no, also an ethical question, but it has become also a political question. It has polarized societies. So isn't this dangerous? I mean, when being vaccinated or not is becoming such a huge political problem, dividing societies.
I have a mentor, his name is Bill Foege, and he's an ethicist and a historian, but he was also the head of the Center for Disease Control in the United States. And he is working on a project right now. He's 86 years old, and with the time that's available to him, the project that he's working on is how can we become the greatest ancestors that we can possibly be? And how can, in our world and epidemiology, how can we learn from the decisions, good and bad, the mistakes and the great intuitions and innovations that came from smallpox eradication and polio eradication and now COVID? And the first thing I want to say to all of you, the world is not ending. Your lives are not screwed. The tools that we have to deal with the diseases we're going to talk about today are the greatest tools that anybody's ever had. We've never had vaccines like we've had. We've never had antivirals and monoclonal antibodies that we have. There is an equilibrium between the diseases that we face and the tools that we have. And the deciding factor, the thumb on the scale, are political decisions. So it's not really that the bugs are out to get us. It's that we have to be very careful in the political systems that we choose, the people that we find as our leaders. So let's take a couple of examples, and I won't choose Australia. I'm not exactly sure why I won't, but I won't, out of neighborliness. Let's take Sweden and China. Sweden, that progressive country that we all think about as being the leader of liberality and freedom, and usually always makes the right foreign policy decisions. And I think, at least in my world, we're really fond of Sweden, and it's sort of a light. But they really messed up this pandemic. They have the highest death rate from the pandemic in the world. And that was because of decisions that were made very early, that liberty and individual freedom mattered more than the collective benefit of vaccinating, wearing masks. There was a great anti-mask movement, anti-vaccine movement. And many of the epidemiologists also said, let's let the virus rip through society and we will all get immune and then we'll go back to work. It doesn't work that way. The immunity that you get from having had the disease is not nearly a fraction of the immunity you get from our vaccines, which are tailored to protect you in the future. And as a consequence, if Sweden is compared to Norway and to Germany and to Finland, it had 1.345 times as many deaths per capita as those other countries, which had many more higher vaccination coverage. But let's not quibble over Nordic states. Let's just compare that view in Sweden with China. It's a little complicated because it isn't just that China has these onerous lockdowns. It's that China doesn't have good vaccines. So you can't really say that they're choosing vaccines and lockdowns. China's got a population of about 1.3, 1.4 billion people. Because of the success of their lockdowns, China's had probably one of the lowest incidence rates per capita of COVID in the world. I would imagine that even though they say they've only had 1 or 2 or 300,000 cases, they surely have had less than 1 or 2 or 5 or 100 million cases. Well, that's a small percentage of 1.4 billion people. So there's no natural immunity in China. Let's just say that's a rounding error. And in the United States, 2/3 of our population has had COVID. So we have a high rate of natural immunity. Sweden's got the highest. But now, if you add on the role of the vaccinations, China has probably vaccinated 1 billion people twice. But the vaccine they're using, which had a 40% efficacy against the original strain, probably has less than a 20% efficacy against the current strain, Omicron BA.2. So what does that mean? Let's just do the numbers really quickly. If only 100 million have natural immunity, and only 20% of 1.3 billion have any vaccine-induced immunity, there's almost 1 billion people in China with no immunity at all. So they find themselves now in one of the worst quandaries that any nation has faced, perhaps in any pandemic. Because if they open up too quickly, the estimates are there will be the estimates are that there will be 1 million or 1.5 million dead in less than 1 month. So the decisions that they've made, in large part political, but also ethical and also scientific, put them now in a quandary. If you're attending any of the meetings here at the annual meeting in Davos, there's some extremely good Chinese thinkers, technologists, who are very fearful that China is a ticking time bomb for this pandemic. So now you've got 2 countries that didn't get it right, I guess. So we go to somebody as old as Aristotle, who talked about the golden mean, trying to find the Goldilocks, not too warm, not too cold, in the middle, using what we know about the tools we have from vaccine to get immunity, the number of people who will and won't take it, what natural immunity gives you, and what groups of people are most at risk. People who are over 70 years old, who are living in nursing homes, those who are immunocompromised, obese, diabetes, have just had cancer or treated with cancer-treating drugs, chemotherapy, or if someone like that at home, or someone under the age of 5 who can't get vaccinated. If we take all of these things into consideration and we build a program that's based on sound science, that isn't so heavy-handed out of a political doctrine, that isn't so Ayn Randian, libertarian, go out and let it rip, we can build programs that can end the pandemic in any measurable way, important way, without either violating individual liberties more than are necessary and without pretending that the disease isn't as bad as it is. And that's what I would leave you with, however else we go. The world's not going to, you're not going to die right now. You're not going to get screwed, even though we live in an age of pandemics, increasing because of deforestation, environmental degradation. I hate to tell you that the world you now own is 75% covered with asphalt and the built environment. The world that was when I was your age was only 25%. It was 75% natural. That means that humans and animals are breathing each other's air, living in each other's environment. Last year, in Africa alone, over 1 billion animals were eaten by human beings. Worldwide, it's something like 3 billion kilograms of bush meat and wild meat and exotic meat. So you live in an environment where maybe when you were younger you thought the vaccinations that you got when you were a kid were the end of these silly things like viruses and bacteria. I wish that were true. We all hope that. When I went to medical school, we were told that that was true. We've lived in a way that's promiscuous with the environment, with our natural order, and we now have to deal with this increasing number, and you can just say the names with me: Zika, Ebola, Marburg, West Nile, HIV/AIDS, bird flu, swine flu, SARS. These are diseases that didn't exist when I was a child. And they're new, and they're coming on board at the rate of about 3 to 5 a year right now. So we need to pay attention to it. It doesn't need to take all the oxygen out of the air, It doesn't mean there can't be joy and parties and love affairs, but we need to pay attention to it, and we need to understand that the flip side of that is we have the best tools that anyone has ever had to manage them, thanks in part to companies like Novartis. We have great vaccines, we have great antivirals, and we have great monoclonal antibodies. But we need to have ethical as well as practical decision-making in our political system, or all those tools will go to waste.
Thank you very much. I would open the floor to the discussion to the floor. There is a question here. Wait for the microphone, please.
So for me would be the question, don't we also need to get back to have more love for our nature, to be more connected? So we heard about the indigenous people, and I learned a little bit about shamanism, Inca shamanism, and I also committed to be a nurse keeper. So don't we also need to have a better feeling for our nature, going back to the nature, and also about food? So how can we be a robust citizen also in the world? So to be better prepared to really do our prevention, to not get sick. So because we also see some other issues why people become sick.
Who wants to go first?
I want to, again, use an analogy here. So when you say nature, one of the things that makes nature so robust is that it's an ecology or a very complex system. And I think this is exactly when we talk about, right, like governments making very strong rules, it becomes a very centralized system. And anything that is very connected, that changes the risk profile completely. Nassim Taleb would talk about potential for black swan events or long tail risks. Just more extreme things can happen if everything is more connected. And exactly the opposite is ecology. Many small communities of whatever networks, how they're connected. And exactly this is one of the things where when we talk about mistrust, many people spoke up when they felt like people took too much control about the decision making. I think I think that is adequate because power has to be justified, and people have to understand the limit of the tools they're using, and they have to exactly also give it back, give the power back when it's no longer adequate to actually have decision making and information processing as distributed as possible. So yeah, individuals making as many free choices as they can, so that exactly innovation can happen. People can try things where new ideas come from, where new solutions come from, because exactly, having very, very centralized information processing changes the risk profile, and is exactly, at least in an analogy, contrary to how nature works as a system.
I mean, maybe just not to challenge, but just to offer a little provocative view, because we tend to agree on many things, hopefully, in this room, and I think we all care about nature, and we all know that, as you said, I found your comparison incredibly. I mean, what happened in the last decades here to this planet. The one thing I would call out is, and that's a little bit linked to the science discussion, mistrust in science. Unfortunately, all these topics are not only complicated, but hugely complex. And I would say, don't trust people who come with the easy answer. Let's take food and nature. I mean, we are running potentially, due to this horrible war, into potentially a worldwide food crisis, which would potentially not hit you here in this room, but the global south and others who have anyway suffered. Same as for energy. I mean, there will be an energy shortage potentially due to the war. So now, is the solution there easy? No, potentially not. And not very happy answers. I mean, potentially we need to go back to energy resources we don't like. Coal, fracking, oil. We may go back to get food on the table to topics we don't like. More agrochemical, treatment of plants and to grow the available food for the world. And these are hugely ethical, complex decisions, because if you say, no, I go with the easy answer, I don't like coal, I don't like fracking, we keep out, the people will suffer, and potentially not us in the first place. We will survive. Yeah? And the same is for the food topic. So, and this is again just a call to be opener for different views and be opener also for scientific dialogue. And science can do better. I mean, Larry, you're brilliant how you explain this. Unfortunately, most of the scientists are not. And there is mistrust there, because also scientists are not the best communicators, let's face it. It's not easy to get this over. You did it greatly. But be open and don't get into this camp and say, I don't trust them, and there's an easy answer, and the easy answer is this is good and this is bad. It's not. And exactly your generation, my kids, will have to confront these complex topics much more than my generation, a generation which is currently in the governments or in the companies, in the management.
Can I just add to that too, Klaus? I think there needs to be an acknowledgement that science is also vast, and our way of knowing, being, and doing is 80,000 years old. It's the oldest continuous culture in the world, and we have science that extends that period of time, and our people are constantly challenged about our science as not being valid science. But I can tell you, no one in this room can read country like elders that have 80,000 years of knowledge about how ecosystems work. So I think it's very important, while we're talking about the validity of science, not to exclude different types of science that might not come with a university badge or degree, that we consider and consult with people like First Nations elders and knowledge holders about what might be happening in these places. And back to your question as well, as First Nations people and as a Darug woman, there is no other healing that comes to me and my mob than being on country. And we yearn for it when we're away from our country, and there is something so significant about being able to reconnect to our place of our ancestors. Our ancestors are living in that country where we are, and it's grounding for our people. And if that's what improves our mental health rather than a pill, then I think that we need to go there.
Thank you. We take the question here in the first row.
Thank you for this wonderful panel. It's so informative and so enlightening. My question is a difficult one, and I'm fully aware. How does ethical decision-making now impact the leaders in the decision whether they should send weapons or not? And how, I would love to hear your thoughts on that, especially, you know, with all that we have heard today, with, you know, that we have to consider the impact on further generations, that we hear that there is a food crisis coming along and an energy crisis, and that there already is now a heavy suffering. What would you think about that? I know it's a difficult.
Yeah? Because you said it was difficult, of course, the idiot raises his hand. I was raised as a nonviolent activist, you know, fighting against the war in Vietnam. I marched with Martin Luther King. I heard him say, and you probably all heard this, he said that the moral arc of the universe bends towards justice. But that's not actually what he said to us when we marched. He said the moral arc of the universe bends towards justice, but it's not going to bend towards justice on itself. You have to get your ass out of the chair and jump up and grab that arc and bend it and twist it towards justice. And that becomes the dilemma. It requires all of us putting our best into it to make decisions that our leaders will follow. And to do that, we need to think hard outside of the box. Listen to people who come from worlds that are different than ours. So right now we're facing one of the most tyrannical assaults on democracy and on sovereignty that Russia is foisting on Ukraine. Whatever the reasons or the animus or the unrequited love between these countries that led up to it, it doesn't justify the murder of thousands of Ukrainians. So what do we do? It's so difficult because if we push the world towards a third world war, towards a nuclear war, the results are absolutely catatonic. If we do nothing and Russia takes over Ukraine, I think there's some real risk that it keeps on going. History teaches us that a dictator that is not fought back against doesn't stop on their own accord. Like a metastatic cancer, it doesn't stop on its own. But we need the best thinking of everybody. We can't just have politicians who want to get elected. And we don't live in a world, this is not a good time to have a war. It's not a good time to have a pandemic. When I worked on smallpox eradication, it was right after the Second World War. It was during the Cold War between the United States and the Soviet Union. But still, we were able to get people from 200 countries, people who had black or yellow or red or white faces, who were Muslim or Hindu or Jewish or Christian, who were Baha'i, all working together, speaking different languages. Because the challenge of eradicating a disease that had killed 500 million people in the last century, because the horror of seeing that disease on people's faces made us all put aside, sublimate our individual decision-making to what would be the greatest good for society. This decision is harder. It's harder because we don't have that same moment. I think after the Second World War, when the world looked at the firebombing of Dresden and they looked at the mushroom clouds of Hiroshima, Nagasaki, and they looked at the skeletons coming out of the concentration camps, they didn't want that to ever happen again. And they didn't have a meeting to decide it, but they said never again. And then there was this flurry of international organizations, the UN, the Security Council, WHO, UNESCO, Bretton Woods. These were all centripetal organizations. They brought us all together. My generation, we wanted to get in a VW bus and travel all over the world. We wanted to see the whole world because we felt like we were children of the world. But the world is not like that now. We have many centrifugal forces tearing us apart. Nationalism, selfishness, religious xenophobia, I think. It's a bad time for us to have the clarity of mind to deal with a question as difficult as the one that you have raised. But a beginning would be to listen to all the voices with full honesty, with full transparency, with everyone having a chance to say what the risks, the benefits, their fears, and their hopes are. We haven't had that. The world has not had that discussion. So we are observers in decisions that are made without your voices, without the voices on this panel, perhaps. And that makes it a very dangerous moment in time. I wish for the wisdom of our elders. I wish for the decision-making of our political class, but I don't find that to be nearly as good as what you said, the wisdom of crowds. So I don't answer your question, but I hope I help you ask some other questions about the tools that will help us.
Anyone else wants to answer this very difficult question?
Only one sentence. I think wherever you stay, it's a hugely personal decision, but some people have to make a decision as heads of state. But I think one thing we need to acknowledge, no one leaves a war innocent, no one. I mean, wherever you see the sympathy, and there is clear, I think there's a clear violation of international law and people are suffering. But even if you take the decision, I deliver the weapons, I think it's an ethical acknowledgement to also acknowledge no one will leave this war as an innocent party, right? Because I believe that's part of an ethical decision-making, not to say I'm a saint, I know what I say, but to acknowledge even if I come to a decision which is so difficult to acknowledge, I will not be the same person after this decision as I was before. I will not stay innocent, but there may be reasons why I have to go this step, all for the reasons Larry mentioned. And these are missing sometimes in the discussion, you know. It's a very fact-based discussion, and this acknowledgement that this the loss of innocence will be there for everyone who is involved in this.
But also, I think, I don't know, Mr. Mosmeier can tell better than me. I'm only half German, so. But there is also a history, of course, teaching, because there has been a lot of Olaf Scholz bashing, no, about the fact that he wasn't sending weapons to Ukraine. But think of German history. I mean, they started 2 wars, and they killed millions of Russians. So I think I criticized a lot Scholz in my newspaper, but not especially not on this. Because for Germany, it's still a difficult decision to do, to be, to have a military presence in Ukraine, right, Mr. Mosmeier? I think you can also, so it's out of historical and ethical questions, but I think it's not wrong if you ask yourself, as a German, if you can contribute to a war, no? Are there any other questions here? Another one?
Hand up. I have a question, or more like a follow-up comment on what was just previously mentioned. Mr. Brilliant, if I understood you correctly, and I'm not sure I can quote exactly what you said, but I understood that in order to tackle challenging topics and questions like, should we send weapons, yes or no, what should we do in the current situation, I understood you were saying we should listen to both sides and start a discussion first. And then I also understood that all the Russian delegates were disinvited from the forum. I'm not an expert in this, and I can't say if this was a good or a bad decision, but I would be interested in the panel's opinion on that decision by the VWF, that members from Russia, officials, politicians from industry were not invited to join this forum for a discussion to also hear their voices and to trigger and start a discussion. I can sit down again?
Someone wants to intervene on this?
Well, I'll just say that in the smallpox eradication program, I mentioned all the countries that work together. I think one of the most poignant of the countries that worked together was that the Soviet Union and the United States worked so closely together. In fact, the idea for smallpox eradication came from a Russian, Professor Zhdanov, who urged the World Health Organization to do something that had never been done before, which is eradicate the first disease in history and to get all the countries together. And they insisted that the leader be an American. So the Russians proposed the world work together to eradicate the first disease and that the leader be an American. Now, some people thought that's because they thought it would fail, and if it was an American leading, well, of course, then America would lose its credibility. But I don't think that was the case. And as a result, I worked with 35 Russian epidemiologists side by side. We published lots of papers together. We became the best of friends. Our families have stayed in touch for 35 years. It is not a war that is going on between the people of Russia and the people of Ukraine. I think that's the thing that we all need to understand. I think it would have been a really good idea to bring the people of Russia to this event. But the government of Russia is waging the war. And the aggressor is just different than the one that is being aggressed upon. And to bring the government representatives, which is, I think, what WEF would have done. I don't know what all the calculations that went into it. I think that's a different order of magnitude of questions. But yes, democracy works better when you have everybody in the room. Corporations make better decisions when half of the voices are women. We make better decisions when everyone is talking to each other, but it's the people talking to each other. It isn't always the case that governments talking to each other make better decisions.
May I just add, there is a global expert in conflict resolution here at Davos at the moment. His name is Adam Kahane, and he is one of the Schwab Foundation social entrepreneurs. And he specializes, and he's had a very long career in bringing together people that really don't like each other to have really important questions about moving forward together. And he's been incredibly successful at a nation state level and at a very small community level in resolving conflicts. And his methodology is outlined in a couple of books that he's written. And I'd really recommend that you look him up, and if you have time, approach Adam.
Yeah, I think one of the lowest, I'm sorry, and then one of the lowest moments, I think, in this dispute was when the Pope had this Eastern celebration. I don't know if you remember, he celebrated Eastern as usual, and there were a Ukrainian and a Russian woman holding a candle, and there was a serious discussion about this, about why he involved the Russian women to hold the candles, and I think this is horrible, right?
I also wanted to add something. So Klaus Schwab talked about exactly this decision, and his story was that the forum wants to be neutral, but what does neutrality mean? And he said that in this case, you would, of course, by inviting, you would basically agree to the extent also with this position, and this would not be neutral in a sense in this case. So he just discussed what this term means. And I think this is, so with my background in cognitive science or psychology, what's very interesting and extremely complicated is that there is just, things don't have an objective meaning, right? So if I talk to someone, so for example, you often have it on podcasts, if you talk to someone, you can say, you are giving this person a stage. I can also say, I want to learn from maybe even my enemy, right? I try to take the different perspective to learn from them, but at the same time, you boost the signal. And there's just, things don't have one objective meaning. It's the same with, just with concepts, right? So right now, I think is maybe a chair, but once in the end they clear it out, it's just a piece of furniture. It doesn't matter, it's for sitting out there, it's just material. So the object, what it means changes. And the same is the case in decisions like that. The invitation, it does mean giving the platform to speak to each other and to learn from each other, taking different perspectives. But in a sense, it also means, well, giving access to resources here, to a network, to, just boosting the reach in a sense. And it's not one thing or the other, it's both. And this is, when you think further, this is often exactly the case why we have conflicts. People have different maps of meanings or different ideas or narratives. You have, for example, in conflicts that applies to one-on-one conflict. It's, I think, a theory by Paul Watzlawick, that people have different reference points for when the situation began, when the conflict began. So one person's maybe, oh yeah, I just always leave because you do this and this, and they're like, no, I just do this and this to keep you back, right? Because you always leave. So it's circular, and people have different narratives, and then they clash, and it's extremely complicated. And yeah, in the end, they have to say, I don't know, but I think it's just very important to exactly take into account different narratives, how you can connect different dots to different pictures, and how they clash. And I have no position on it. I think Klaus Schwab had to make a very difficult decision, and I think he tried to really do the best he could. I don't know whether it was good or bad.
Someone else, or we'll go to the next question. Is there a question? Here? Okay.
I just wanted to clarify as well in regards to this decision. Actually, the World Economic Forum had to respect the international sanctions, which is also Switzerland took on those sanctions. So that's actually the main reason why our Russian partners were not included. So it was that people were disinvited; they were not included due to the sanctions. So I just want to clarify that.
Thank you very much. Thank you. Other questions?
Thank you. So my question is on the topic of trust that has been brought up several times. Now, people have a natural tendency towards confirmation bias, and social media algorithms know this, and they also oftentimes know us better, our tendencies, our habits and biases better than our mothers and fathers and significant others and best friends. And when their objective function is to optimize engagement, what ends up getting output is content that confirms those biases. And so particularly in situations where we need to act on limited information in order to arrive at an optimal decision, how do we go about properly managing the information that gets disseminated on these platforms?
I can give it a start. Maybe running out of time for this panel, I don't know, it's 8 o'clock already.
Yeah, I think it's the last answer.
Yeah, I mean, the first step, and that's a big topic in corporation, all big organizations, is to make it clear, or to have this bias as a discussion upon acknowledgement. If it's hindsight bias, the group bias, the confirmation bias, and to make this transparent. And then, and this is the big topic for the future, I really believe is, the bias is programmed into our algorithms and it's programmed into the systems. Because we, also in big corporations, we rely more and more on artificial intelligence for good reasons. But you all know this famous example. I mean, when the big tech companies who got thousands of applicants every day want a job in the Googles and Microsoft, they put artificial intelligence programs into their recruitment systems. Just to filter out the candidates. And do you know what kind of candidates they got filtered out? White male candidates. They stopped it because the algorithms were programmed by people who had a bias and get this into the system. And this is, from my point of view, one of the big ethical challenges for your generation, for us. How do we get the bias out of the system? In a personal discussion, I think we can do this if it's programmed in and there's no human final control, human centricity anymore in the system. You come to very, very dangerous, unethical decisions.
I think that's also really difficult too when there's a commercial imperative to have those algorithms in the first place. And I would suggest to you the best thing that you could do, and all generations should do this and relearn how to do this, is to ask questions and ask really great questions about the information that you're being fed. Because we always have a choice about whether we just take what's on our social media feed as the truth, or if we decide to ask questions about the validity of that information. And it's something that they don't really teach in schools in Australia, is how to ask questions. And it's going to become one of these critical skills that everybody needs, because we're dealing with advanced technologies like machine learning, like deep fake technologies, that have serious repercussions if we don't understand how we're going to ask questions about what we're being fed. And for my people, I've been in communities in Australia where if someone's saying something on Facebook ends up with a spear in the leg. Now, if you can't discern whether that person actually said that or not, you can erupt a community into chaos. The only true weapon that we have against that is to ask the question.
I quickly want to jump in, just like, so when I listen here about all the crises that we face, so even I can feel like a lot of anxiety creeping up. And what I've seen in the, for example, effective altruism community, where people were really shouldering a lot of responsibility, many people burned out. And I feel, yeah, just when I listen, I can feel that in myself. So maybe you might also feel right now, damn, there's a lot I gotta do, there's a lot we gotta face. But if you have to decide whether to take action that's actually effective in doing something, but you can't actually do it, and the only thing you do is getting really, really anxious, then your main responsibility is to just focus on yourself. And sometimes this is the most ethical thing to do. And philosophy is first and foremost about having a good life. And part of a meaningful life is to also take responsibility for others. But the first thing is about yourself. And if right now you just feel completely overwhelmed, then just take care of yourself first. And sometimes this can be even the kind thing to do.
That is excellent advice, and I have taken that actually. I run a tech company. I haven't been on social media for 6 months, any of it. I just stopped. And you know what? My life is freaking amazing.
Thank you very much. Thank you to Anna Riedel, to Michaela J., to Klaus Moosmeier, and to Larry Brilliant for this extraordinary panel. And have fun for the rest of the forum. And thank you to Michelle, of course, and the organizers, and the technicians. Thank you very much.